Thank you very much. Is the sound in good shape? Yeah. Okay. Thank you for inviting me to give evidence to the Joint Committee. It's a privilege to be here. By way of introduction, to add to the introduction that Senator Noon just provided, I am a principal research scientist at the Guttmacher Institute in New York. We are a research and policy organization, and we conduct population-level research on reproductive health in the United States and globally. The Guttmacher Institute advocates for evidence-based policies that promote reproductive and sexual health, and our evidence is used by stakeholders on various sides of the discourse. I've been asked to present evidence on abortion trends worldwide and on the characteristics of women who have abortions. And I will start by giving a global overview of abortion trends, which can provide some context for abortion incidence and trends in Europe. This evidence was published in The Lancet last year, and it is based on work that we did in collaboration with our colleagues at the World Health Organization. We estimate that worldwide, about 56 million abortions took place each year in 2010 to 2014, as you can see on this slide. The annual number of abortions has increased slightly since the early 1990s, which is shown on the leftmost part of this slide. It can be more useful, though, to talk about how many abortions take place for every 1,000 women of childbearing age. This is because the absolute number of abortions can increase as the number of women in a population increases, but the number of abortions for every 1,000 women, also known as the abortion rate, is not influenced by the size of the population. The 56 million abortions that take place each year translate to about 35 abortions for every 1,000 women of reproductive age. Another way of saying this is that, roughly speaking, about 3.5% of women of childbearing age have an abortion each year globally. And the global abortion rate has declined slightly over the past 25 years. Moving on to the next slide, we've also estimated abortion incidence across the 17 major subregions of the world. We were not able to estimate incidence for every individual country because we did not have enough data on which to base country estimates. This slide shows the trends in the abortion rate in major parts of the developed world, that is, Europe and North America. We can look at Northern, Western, and Southern Europe together because the abortion levels and trends in these three subregions are similar. The abortion rate is much lower in North America and in Europe, outside of Eastern Europe, than the global average of 35 per 1,000 women. It is about 17 in North America and 21 in non-Eastern Europe. And the rate has declined modestly in both of these regions in the past 25 years or so. Eastern Europe is a different story, as you can tell. As you are probably aware, the abortion rate was very high in Eastern Europe during the Soviet era. It declined dramatically in the past 25 years to less than half what it was in the early 1990s. The abortion rate in Northern, Western, and Southern Europe, or the rates in these subregions, are the lowest subregional abortion rates in the world. And the decline in Eastern Europe is by far the sharpest decline that we've seen in the world. While we weren't able to estimate abortion incidence for all countries, we did compile statistics from countries with good reporting systems for the most recent year for which such evidence was available at the time of our compilation. And the countries on this slide are those where it's recognized that at least 90% of all abortions are included in the official reports. Across these 18 countries, almost all of which are in Europe, the abortion rate varies from 5 per 1,000 in Switzerland to 18 per 1,000 in Sweden. In 8 of these 18 countries, the abortion rate is less than 10 per 1,000. Globally, when we grouped countries according to their abortion laws, we found that, on average, the abortion rate in countries where the procedure is prohibited altogether or allowed only to save a woman's life is not significantly different from the rate in countries where abortion is allowed without restriction as to reason. The vertical lines around each of these data points indicates the margins of error around these estimates, and you can see that they all overlap. This is a bird's-eye view of abortion rates in these groups of countries, and it doesn't examine the various factors that could influence abortion rates in these countries. We were also able to estimate the percent of all abortions that were obtained by married women and the percent obtained by unmarried women, which is shown in this slide. We used data from the United Nations, which defines married women to include women in cohabiting unions. We estimate that about 73% of all abortions worldwide are obtained by married women and 27% by unmarried women, and these are represented in the first two lines on this chart. In the developed world, about 69% of all abortions are obtained by married women. These are estimates across broad geographic areas, and there are variations across countries within each of these groups of countries. I showed abortion rates in countries grouped by the legal status of abortion. Last month, we published estimates of the safety of abortions performed worldwide and in groups of countries classified according to their abortion laws. These estimates were also made with colleagues from the World Health Organization and are also published in The Lancet. As defined by the World Health Organization, safe abortions are those that are done by a trained provider or a trained person and using methods appropriate to the gestational age of the pregnancy. Less safe abortions are those for which only one of these criteria are met, and the least safe abortions are those for which neither of these two criteria are met. About 31% of abortions are in the least safe category in countries where abortion is illegal on all grounds or allowed only to save a woman's life or preserve her physical health. Less than 1% of abortions are in the least safe category in countries where abortion is permitted without restriction as to reason. We also found that abortions are more likely to be unsafe in low-income countries than in high-income countries, based on World Bank classifications of countries. Countries with restrictive abortion laws tend to be low-income countries, and Ireland is anomalous as a high-income country with a restrictive abortion law. So it's not easy to assess the relationships of economic development and legal status with the safety of abortion. We did not have enough information with which to estimate the ages of women obtaining abortions across the world's subregions. Instead, we compiled statistics from the countries with good quality reporting, and these are countries with liberal abortion laws where at least 90% of abortions are included in the reporting systems. Across the countries with this information, about half of abortions are obtained by women in their 20s, and another one-third are obtained by women in their 30s. Across all of these countries, adolescents 19 years old or younger, predominantly adolescents 15 to 19 years old, account for a smaller share of abortions than their share of the population. That is, the abortion rate is lower among adolescents than among women in their 20s and their 30s. In almost all of these countries, adolescents' share of all abortions has decreased since the early 1990s. That is not shown in this slide, but it is in the evidence that we've compiled. And in countries that further break down the ages of women having abortions into smaller windows, the majority of adolescents' abortions are obtained by 18 and 19-year-olds. According to the statistics that we compiled from 15 countries, 48 to 74% of women who obtained an abortion already had at least one child. In all but 2 of these countries, more than half of women obtaining an abortion already had at least one child. We are currently preparing a report on the gestational ages of pregnancies when they are terminated across countries that have reliable statistics. The blue and gray bars together on this slide represent abortions done in the first trimester of pregnancy. And according to these preliminary findings, in all but 3 of these countries, 90% or more of abortions are obtained in the first trimester. For 4 countries, we have information from nationally representative surveys of women on the reasons for wanting an abortion among those who have had an abortion. The point to take from this colorful chart is that women obtain abortions for a wide variety of reasons. In these surveys, women were asked to give just their primary reason for having an abortion. So, for example, in Belgium, the country on the left, about 1/4 of women said that they sought an abortion for socioeconomic reasons, and another 1/4 had an abortion for partner-related reasons. For example, their partner did not want to have a child or their relationship was dissolving. About 18% wanted to space their children or postpone having a child, and another 13% already had as many children as they wanted or could manage. About 1% of women in Belgium said that they were having an abortion because of issues related to the health of the fetus. In the other 3 countries, less than 1% of all abortions were obtained for reasons related to fetal health. In a survey in the United States, women who had an abortion were asked to indicate all of their reasons for having an abortion. And an interesting takeaway message from this survey is that many women gave more than one reason. Financial issues, wanting to space or delay childbearing, and partner-related issues remain common, and about 30% of women said that they sought an abortion because they needed to focus on the children that they already had at home. I'll shift gears and also wrap up by giving a broad overview of abortion laws of countries across the world, and Leah Hector will go into more detail on this topic. Of the 199 countries and major territories in the world, 75 allow abortion without restriction as to reason or for socioeconomic reasons. 58 countries and territories allow abortion to preserve a woman's physical or mental health, and 40 allow abortion to save a woman's life. Ireland is one of these 40 countries. In 26 countries, abortion is not allowed for any reason, although some of these countries make exceptions in cases of rape, incest, or fetal anomaly. Looking now at just the 50 developed countries, and we use the UN's classification of countries according to whether they are developed or developing, 41 of these countries allow abortion without restriction as to reason or for socioeconomic reasons. 5 allow abortion to preserve a woman's physical or mental health. 1 country, Ireland, allows abortion to save a woman's life, and 3 do not allow abortion on any grounds. So I will end by summarizing some of the key points from this review. The subregions with the lowest abortion rates are subregions in which most countries are developed countries and where abortion is legal on broad grounds, and countries with strong reproductive health programs. Women obtaining abortions represent a broad spectrum of all women, young and old, single and married, childless and with children, and many women who seek an abortion have multiple reasons for doing so. So I will end there, and I thank you again for inviting me.
Thank you.